Welcome back to Medical Coding with Blue. Today's episode is all about the Hcpcs Level 2 study hacks. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So, Hcpcs. I get this question a lot about Hcpcs. Blue, I don't understand Hcpcs. It's so confusing to me. I don't know why we have this book. What do we do with it? Okay, so I'm going to answer these questions today. However, I will say this also. I am not fancy when it comes to editing and stuff like that. I talk through my videos. But what I can offer you is a interactive experience. So if you have the Optum 2023 Hcpcs Level 2 book, the Expert Edition, you could follow along with me. And I will be going through the book and I'll be calling out the page numbers. And so that way we can work through this together and look at the book together. So the biggest thing that I will say that you can start out first, if Hcpcs was not a big part of your program and you didn't learn a lot about it, don't worry, that is very common, okay? Because of the simple fact that Hcpcs is basically at the end of the line when it comes to like learning medical coding. Because they figure by the time you have learned ICD-10-CM and CPT, Hcpcs will be a breeze for you. And it typically is, because again, this book houses procedures that are insurance carrier specific. So sometimes some insurance carriers won't have you report a CPT code, they'll have you report a Hcpcs code. And it really all depends on who the carrier is. And sometimes it's for government programs like Medicare. So one of the best examples that I can talk about for that would be Medicare when they have the colonoscopies. So there's 2 colonoscopy codes in the Hcpcs book for Medicare. And one is for high-risk colonoscopy, and then one is for your regular average screening colonoscopy, right? And so the reason that they do this is because everything in health information is data-driven. Everything is. And so what better way than to create 2 codes, and so it'll be easier to be able to run reports and say, okay, we had this many people who were high risk, and we had this many people that were average risk when they had their colonoscopy screenings. So that is a good example of, when Hcpcs codes apply. If the patient has Medicare, you're not going to be using the CPT book for their colonoscopy. You would use the Hcpcs book for the colonoscopy. Now, if they have commercial insurance, that's when you can use the CPT manual, because CPT has a lot of those colonoscopy codes in it as well. So that's just something that you got to know when you're doing this. And the thing that I would tell you also is this: if your facility has specific guidelines about when to report Hcpcs codes or when to report CPT codes, that's something that you really have to review. And not just review it only one time. It has to be reviewed every year, because as you know, things change. And of course, codes get deleted and updated and there's new codes added. So you want to make sure that you're always staying on top of those payer requirements, payer guidelines, because if you don't, that can lead to a whole big old mess. And don't ever get complacent with, this is the way that we've always done it. That is, those are like nails on the chalkboard words for coders. We've always done it this way. No. Things are going to change every time. There's going to be a lot of things that become routine, but you have to watch yourself, because you don't want to slide into something like, oh, I've always done it this way and I forgot. These coding guidelines have to be looked at every single year when the updates, are around and things like that. So that's something that you got to know. But let's go ahead and get into this book. So I'm using the 2023 Optum Hcpcs Level 2 book, the Expert Edition, right? And then when we go into the introduction, it tells you all about like the different things that what these codes are made of. So sometimes different manufacturers' codes and things, and it talks about that. It talks about how the dental codes, the dental codes are not included because the American Dental Association has those, but everything else is here. So then it gives you like examples of how to use the Hcpcs Level 2 book. And then it says coding standards, levels of use. It says coders may find that the same procedure is coded at 2 or even 3 levels. Which code is correct? There are certain rules to follow if this should occur. When both a CPT and Hcpcs Level 2 code have virtually identical narratives for the procedure or service, the CPT code should be used. If, however, the narratives are not identical, the example is the CPT code narrative is generic, whereas the Hcpcs Level 2 code is specific, the Level 2 code should be used. Be sure to check for the national code when a CPT code description contains an instruction to include additional information, such as describing a specific medication. For example, when billing Medicare or Medicaid for supplies, avoid using the CPT code 99070, supplies and materials except spectacles, provided by the physician over and above those usually included with the office visit or other services rendered, like trays and supplies and materials. There are many Hcpcs Level 2 codes that specify supplies in more detail. And then it talks about submitting special reports. So submit a special report with a claim when a new or unusual or variable procedure is provided or a modifier is used. Include the following information. And then it goes into like a copy of the appropriate report explaining the nature, extent, and the need for the procedure, documentation of the medical necessity of the procedure, documentation of the time and effort necessary to perform the procedure. And then it talks about how to use the Optum Hcpcs Level 2 codebooks. So it talks about the index and the appendixes, and it breaks down everything that can be found in those. So like Appendix 2 has modifiers. This appendix identifies current modifiers. A modifier is a 2-position alpha or numeric code that is appended to a CPT or Hcpcs code to clarify the services being reported. Modifiers provide a means by which a service can be altered without changing the procedure code. They add more information, such as an anatomical site, to the code. In addition, they may help eliminate the appearance of duplicate billing and unbundling. Modifiers are used to increase the accuracy of reimbursement and coding consistency, ease editing, and capture payment data. So again, some of the modifiers, and I'll have to go into a whole thing about study hacks for modifiers on another episode. But with the modifiers, knowing when it is appropriate to apply them and knowing what they mean and understanding them is going to be key to a lot of things. So just those are things to keep in mind. And again, that's going to be in the appendixes in here. But one of the other things that I wanted to point out that is so prevalent in this book on the introduction, Roman numeral, Roman. I was watching one of the other animal shows I like to watch. Not Think Like a Horse. It wasn't. It was I'm a Survivor Sanctuary, and they were talking about rumen on the goats. But anyway, so Roman numeral 3. We have on Roman numeral 3. They have where it says CMS. So you'll see in red when you go into the tabular section, there will be in red sometimes on some of the codes a little CMS, and it'll be in red. And it says this notation appears when instruction pertaining to a code appears in a CMS Internet Only Manual IOM. Previously, Appendix 4 contained a verbatim printout of the Medicare Internet Only Manual references pertaining to specific codes. This appendix now contains a link to the IOMs on the Centers for Medicare and Medicaid Services website. The IOM references applicable to specific codes can still be found at the code level. So it'll say like CMS, and then it'll have some numbers, like it'll give CMS a colon and then some numbers. And then you'll also see AHA, right? So AHA, and that'll be in purple. Okay, you'll see that throughout the book as well. but this is what it means. So AHA, the American Hospital Association's coding clinic for Hcpcs citations, help in finding expanded information about a specific code and their usage. This includes citations for the current year and the preceding 5 years. So sometimes when questions are sent in to the American Hospital Association coding clinic, right? And they have it, of course, for diagnosis. Of course, they have it for Hcpcs. They also have CPT assistant. Okay, that's something completely different. They're all their own little thing, right? But if you have questions about when does this particular code apply, you can, if you have access to these, you can go into, in this case, the AHA Hcpcs coding clinic for Hcpcs, and you can go in there and you can you can reference that particular chapter. So it'll say AHA, and then there's a colon, and then first quarter 22. So what that means is in 2022, the first quarter, there's going to be a passage about that particular code. So in this instance, they gave the example of A2001, ANOVA matrix AC per square centimeter. There is a specific AHA, American Hospital Association coding clinic for Hcpcs about it, first quarter 2022. Okay, so they say it's going to be that, 5 years. Okay, they're going to go back the last 5 years. So they have really good references in here. But if you ever spend time looking at coding clinic or CPT assistant or any of those, it's really helpful because these are like questions where there's a little bit of there's a gray area, and there's these experts that are answering, and they can actually break it down for you on why this would apply and why it doesn't apply. So I like to read the coding clinics because it really does help you to better understand. And there's a lot of things that you can learn throughout those coding clinics. And it's very, very important to read those. They do have it where you can buy the membership, buy a subscription, not membership, where you can buy the subscription. You can do that if you want to, but most times at most facilities, when they have those types of things, when you're using like an encoder, like at my facility, we have that access through the encoder. And so it's part of it, part of the package that they have. And so that's how I'm able to access that. But again, sometimes people don't always have that access. And then sometimes these facilities don't really understand what coders need. So they don't know to purchase those types of things. But it is worth it if you end up having to need to purchase it. Because whenever you're having to argue back in an audit, these are the things that you can cite as well, in conjunction with the guidelines, of course. Guidelines are always going to come first. But they always say use your guidelines, CPT assistant, or the coding clinic. So that way you can make your case if there's something that is like similar or even the same, so. But yeah, that's what you want to know about that, because I get that question too. What does that mean? AHA is right here in the introduction. You can see that. And then on Roman numeral 5 or V, for those of you that don't know, the ASC payment indicators. So there's a whole list of them there. And then it says this icon identifies the ASC status payment indicators. They indicate how the ASC payment rate was derived and or how the procedure, item, or service is treated under the ASC payment system. And this is for more information. You can go to the Optum's Revenue Cycle Pro, and it talks about where to find more information. But it's also here too, so you can look at those. And then they also have on Roman numeral 4 or IV, just so you guys know, OPPS status indicators. So they're in purple. The status indicators identify how individual Hcpcs level 2 codes are paid or not paid under the OPPS. The same status indicator is assigned to all the codes within the ambulatory payment classification, APC. Consult the payer or resource to learn which Hcpcs codes fall under various APCs. The OPSI contained in this, publications were effective October 1, 2022. Once released by CMS, the table with effective data January 1, 2023 will be available at our product update page at, and then it gives the whole thing. But it also lists those there, so that way you can kind of see them in action. Then we have the index. The index is only 20 pages, and one of the other channels I watch is Think Like a Horse. Rick, he used to be an instructor, he was in the military and that kind of thing, so he knows how to teach adults. But he always says this one thing that I really like, which is, you don't know what you don't know. And what this means is, of course, we should all be trying to educate ourselves, but sometimes, because there's so much information, we don't know what we don't know. The best way to hack this CPT book is to start with the index. Start with the index. You look at all the things that are available in this book. Now remember, as I said, you're not always going to report the Hcpcs codes, okay? You're not always going to report them, because some of them, it's really, program specific, or insurance specific, and sometimes it's going to be the CPT book. But again, this is going to be your supplemental information. So on those supplemental codes, like for the injectables and things like that, the medications and things, or like the equipment, the bandages and stuff like that, if you're coding for a PT clinic and they give out like little exercise bands and things like that, those are the things you'll be able to find here. And so again, sometimes when these things are reported, sometimes the insurance will pay it and sometimes they won't. It really all depends on their guidelines. But not all payers are the same, and not all government programs, are going to cover the same, you know what I mean? So there's going to be differences in their payment models. But it doesn't mean that the codes shouldn't be picked up, okay? So sometimes they will say, yes, we acknowledge this, we see it, but we're not paying for this. But it still needs to go, on there for statistical data. So whatever the billers are billing, that's what they know, because that's their job is to know about the payer guidelines and stuff like that. But as the coder, you should also know it too. So that's just something to keep in mind. But again, like I say about the colonoscopy codes for Medicare, you're going to report those. You're not going to use CPT when it comes to Medicare for the colonoscopies. You will use the Hcpcs code, okay, depending on what the risk level is for that patient, all right? But starting off on the first page of the index, you'll see all of the different things that's here. Of course, it starts out with abdomen, and then it talks about dressing, or like pad, low profile, and then abduction, ablation, and then it keeps going. Arthroscopy, artificial, assessment, assisted living. So there's a lot of different codes, guys. A lot of different codes. This covers services. It covers equipment. It covers all kinds of stuff. Let's see what else. It covers counseling, right? There's another one for counseling. I'm trying to carefully watch my words, because there's certain things I know I can't really say and talk about. But there's all kinds of things like bariatric bed is in here. Bariatric surgery is also in here. There's a code for it. But there's also those codes in the CPT book. So again, pay attention to the payer requirements. Okay, so that's just what you got to know. The cannula, they have nasal cannula, they have tracheostomy, they have a cardiac monitor, implantable. They have that code here, and you'll see C1833. So when you see the code there, that's when you flip back to the tabular section. It's the same way as with the other two books, the ICD-10-CM and the CPT. Okay, you're going to start there. You're going to go to the tabular section. Let's go there to the cardiac implantable, C1833. And when we flip there, let's see what it tells us. C1833, which is on page 21. So it says monitor cardiac, including intracardiac lead and all system components implantable. There's the CMS little notation there, and there's also the AHA coding clinic, first quarter 2022. Or it says 22, but it means 2022. And as we look, if we look back on page 20, right, we see there at code C1820, generator neurostimulator implantable with rechargeable battery and charging system, right? That code is C1820. And then in the blue, in the cool blue lettering, it says used to report neurostimulator generators that are not high frequency. So it's giving you a little bit more detail. And then it says, of course, the CMS notation. But I only brought your attention to that because I wanted y'all to see in action those notes throughout the book. So there's that. But going back to the index, we see all of the other options they have. We're here. Look, it says for classes. Specifically, it talks about asthma classes, birthing classes, exercise classes, infant safety, nutrition, parenting, smoking cessation. So there's also those codes there. You know, I did have a provider that came in and was asking me about that. I'm like, there's a tobacco cessation counseling in the book that I use, the CPT code, you know. So there's a code for that versus this one here. Again, these codes in here can sometimes be insurance specific. So sometimes they may say, hey, if you're doing that, we want you to report this code, you know. So again, something to keep in mind, or even ask the biller about. I always say that coders and billers are cousins because we fall under the same family, of course, health information, but we have different roles. And sometimes it is the same person doing the billing and the coding. It really all depends. So that's something you got to know. But there's those codes there. So if we wanted to look at the exercise class, right, that's under code S9451. So we flip back to S9451. And we see here S9451. Exercise class, non-physician provider per session. Right? So like a yoga instructor, right? You know, so that's something that, because the yoga instructor is non-physician, okay? So I'm just saying that as an example, all right? Just going with the example here. But yeah, so that's where it's going to tell you. And then nutrition classes, non-physician provider per session. They have smoking cessation classes, non-physician provider per session. Stress management, okay? So they have all of those individual codes there listed. And so, again, this book is worth exploring, okay? And that's part of your job as a medical coder, too, and your tasks and learning is to look at, see what they have available. And how does that factor into what you're doing at your facility, right? And if it is that they're injecting a certain medication, then you got to see if there's a Hcpcs code for it, okay? And then, again, you're reporting that because that is, if it's documented, then it happened. And we got to make sure that we collect all that information because, again, reporting when certain medications are injected helps to justify why a facility orders a certain medication. And some of these medications, they get very expensive, guys. And they have to be able to justify ordering this stuff. So they can always run a report based on what the coders have selected and based on what has been coded and submitted. And then they're able to see, okay, well, this many patients had, you know, a steroid injection, or this many patients had this kind of pain injection or whatever. And so they use this medication and this medication. So they know what's being used. They can, again, justify what they're ordering, or they're saying, well, this patient got bands to help them exercise with. Okay, so that's another thing that was here in the Hcpcs book that was reported that can be harvested from these reports, from these data reports, right? Just by running the code. Okay, so I'm already running out of time. I can't believe it. But the other thing I want to talk about too, I know we're going to get to the, very quickly, we're going to get to the appendixes here in a minute. But if you are like in a clinic where they're giving out like supplies and stuff like that, you can always look at the supplies itself. Because like sometimes like on the inserts, the shoe inserts, like if you work for podiatry and they give out shoe inserts, you can see on the box, it'll have the Hcpcs code sometimes. So that's how you know that that's the specific code for that particular item. So if that's the case, then you can, make sure that you tell your provider, okay, make sure that you document in the documentation that this is the material that you're giving out. And then of course there is the code. And so then that's how you know that you're able to select it. Sometimes you can, if you tell them, hey, you could put the brand name and then like the quantity and all this other stuff. So that way you can select that code because it's supported in the documentation, right? And sometimes if they don't know how to locate that Hcpcs code, you can always do a Google search, depending on, what items your clinic stocks, and always look and make sure, because I've done that. I have done like an inventory where I'm looking at all of the things that we offer in our clinic, and I make note of all the Hcpcs codes that I see, and it's really, it makes it a lot more efficient that way too, because exactly this is the product and this is what we did. And so again, it's really good for statistical and data collection and all that good stuff. So Appendix 1, you're going to go over some meds there. But it tells you, and that is on page 1 of the appendixes, and it's giving you the name, it's giving you the per unit, the route, and then it's giving you the code. So if you ever need to look those up, that's where you can go. All right. So again, take the time to just look through them in general. And that is a pretty good size index. It is 31 pages, but just take the time to just look at it and review it. So that way it can be in your brain. It's a primer for your brain. Okay. Appendix 2 has the modifiers. It's got all of the ones listed here. And it's telling you what each one of them means. A1, of course, is for dressing for 1 wound. A2 is dressing for 2 wounds. All right. And then we have just the different other ones there, continuing on. GM is multiple patients in 1 ambulance trip. So I know, like, when would you ever report that? But there's KA for an add-on option accessory for a wheelchair. There's a lot of detail here, guys. So again, Appendix 2 for those modifiers. Appendix 3 is your abbreviations and acronyms. A lot of y'all talk to me about those things. This is where you got to go, guys. This is where you got to look and start getting used to those things. Again, it is going to put that in your brain. You don't have to memorize these because you get to have your books with you. Okay, so don't sweat it. But get it in your brain to, like, okay, I'm looking at all of these, and take the time to look at each one of them so that when you are reading the documentation and the providers are writing these things, or you're seeing these in the code descriptors, it's not going to be so overwhelming for you because you already know where to find that answer. And then we have Appendix 4, that's the Medicare Internet Only manuals. Appendix 5 is your new, revised, and deleted codes. And so you want to look at those, especially if something's happening when you're entering a code in and it's not taking it. You want to look there and be like, okay, yeah, that's why, because it was deleted. And then we have Appendix 6, which is place of service and type of service. So this is going to be the same thing that's in your CPT manual. Like your place of service code is 01, that's the pharmacy. And so then it talks about like a description of what it is. So that's here. And then we have type of service. That's also here in Appendix 6. Appendix 7 is the deleted code crosswalk. And then Appendix 8 is the glossary. So again, another great place for you guys to look at for medical terminology. Okay? So even if you wanted to shorten your medical terminology for the day, just look at those words. Just look at them. So that way, again, it's just more practice for you. And then again, it's not going to be so overwhelming. You'll start to learn that language a lot sooner. And then we have Appendix 9, which is the Quality Payment Program. So there's information about that here. And that is it. And I hope this thing doesn't turn off on me because otherwise it'll delete my whole video. So with that said, I'm going to go ahead and wrap this one up. Guys, get comfortable with the uncomfortable. Okay? That's what I got to say. Get comfortable with the uncomfortable. The more you spend time with these books, the easier it will be. No, you do not have to tab them. No, you do not have to write in them because they are already written by doctors and scholars. It's got all the information. All you have to do is learn how to use it. So take the time to look at it, read it, and get acquainted with it. All right. So if this video helped you, Please like and share. Like, subscribe, and share, and I will see y'all next time. Bye.